Thank you, Mr. President, and thank you, members. This interstate nurse staffing compact, I don't think it's a solution. I don't think, as some said, it's even a partial solution. If anything, I think it makes our healthcare system less safe. And I want to start by saying I think there's no disagreement that there are shortages of nurses staffing our hospitals. If you talk to the nurses who work in the hospitals, exactly what Senator Eaton is saying. They were struggling with shortages before COVID, and COVID's made it worse. Talk to the nurses how stressed out they are, how they're concerned about whether the patients are getting the time they need, the care they need. Let's be clear, there is a shortage of nurses in Minnesota hospitals. In our hospitals, there is a shortage. But that's not because there's a shortage of nurses in Minnesota. It's not something this compact is going to address. This compact would not address the shortage of Minnesota nurses because there isn't a shortage of Minnesota nurses. It's a decision by hospital systems and the corporate leaders that's leading to the short staffing we've got. Minnesota has, and I think it's the SEIU letter that Senator Wickland handed out, points out there are 16 nurses in Minnesota per 1,000 residents. That's 30% more than the 12 in other states on the average. We are 30% better equipped to meet our nursing needs than other states, 30% better. Minnesota does not have a shortage of nurses. What we have is a shortage of nurses in the hospitals because the hospital systems have decided that they can short-staff them. Some of the most vocal proponents of this bill, Senator Nelson sent out a long list. Some of the most vocal proponents are the hospital systems. They're the corporate entities pushing this bill who are causing the problem of short, unsafe staffing in our hospitals. When nurses are responsible for more patients than they can safely handle, when a situation should call for one nurse for every 2 patients post-surgery or intensive care or whatever, and they're covering 3 or more, those patients suffer. If it's a lower level of care and they should be covering 4 or 5 and they got more than that, those patients suffer. And the nurses are stressed out about it. They're working as hard as they can to protect their patients, even at their own health expense. A lot of the nurses don't even have time to eat. A few years ago, prior to COVID, I talked with a nurse at Fairview Riverside. She articulated the problem clearer than anybody else I've heard. She said she had worked there for 17 years. She said she's always had a trouble with having time to take a lunch break, until recently. She said in the first 16 years there, she had fewer lunch breaks than she had in the last 9 months. Why? What changed? She got a new assignment. She was working in a surgical unit. And apparently, federal law requires a staffing ratio in surgical units, in operating rooms. So you got one requirement, you've got to have a nurse in there. If they're in there for 8 hours a day, the nurse has to have a lunch break. State law at least requires that. And you got this conflicting thing, so the hospitals have to meet the thing, and they substitute, they bring in a nurse so the nurse who's been in there can take a lunch break. So she said she was getting a lunch break every single day. That's the way it ought to be. But talk about nurses who don't. She said that previous to that, and what I think you'll hear from other nurses is, they pack a lunch. They pack a lunch and they be there, but they don't get a chance for it. It's not a rare occurrence. Talk to any hospital nurses. Every one of us has a lot of them in our district. Ask them if they've ever packed a lunch or a meal before going to work. And then they eat their lunch in the car on the way home from work. Tell that story to a nurse. Ask them if they ever heard that. They pack their lunch, they don't have time to do it, to eat it, so they eat it in the car on the way home. Some of us may do that once in a while. They do it routinely. That's not good care for patients when the nurses don't have time to take breaks, when they don't have time for lunch, when they're required, often without advance notice, to do double shifts. That's stress. That's hard work. And when they feel they can't spend time with a patient that needs their attention because they're called to another one and they can't get more staff in the hospital, they're troubled by that. They have problems with it. We would have more nurses if we took care of the ones we have. We have plenty in Minnesota. We just don't have enough in the hospitals. If we want safe patient care, we got to address this. Our hospital systems are ignoring it, and this bill doesn't fix it. I talked to a nurse, an RN in her mid-50s, 2 weeks ago, who told me she was quitting. She retired. She said she still loved nursing, but she couldn't take the stress. She said it used to be she had a feeling that she was really providing good care for patients, but she felt it was not a safe work environment for her patients. She quit because of that. She said she'd love to go back. She'd love to go back if she could have a safe workplace. That's why I think Senator Murphy's bill, whatever it's called, the Nurses at the Bedside Act, that bill would, some people would say, oh, they can't possibly do that. We don't have enough nurses here. Ironically, by taking care of the nurses' needs, more of them are willing to work if they know they're not going to be forced into double shifts, if they're not going to be forced to work through their lunch break over and over every day. This bill, as I said, is pushed by some of the people who are causing the problem, the hospital systems that could address the problem and refuse to address the problem. I want to say that if you look at it, of all these lists of all the people who are supporting the bill, I see one of the handful of letters opposed to it from Elder Voices, family advocates. I got to know them a couple years ago when they were fighting to make sure we had better care in our nursing homes. Their sole purpose, the reason they were founded, was to make sure that elderly people get decent care. They're against this because they think it's going to make the problem worse. The problem with our health quality and safety isn't a lack of nurses, it's decisions made by hospitals that understaff them. They refuse to safely staff and they're burning out nurses. If we want these nurses to come back, let's provide safe staffing for them. I ask you to reject this bill. This bill does nothing to address that problem, nothing to address the shortage of nurses in Minnesota because there isn't one. And it does nothing to address the problem that the hospitals could take care of by providing safe staffing. I urge you to reject this bill.